Here's 10 nursing questions to test your clinical knowledge, all right? A few of you said my last quizzes were too easy. So I scrambled the difficulty level this time with a mixture of baseline fundamentals and advanced clinical scenarios. So those of you who were complaining, make sure I see you in my comment section, okay? To the rest of you, drop your score in the comments, okay? Question number 1. Blame them for the difficulty levels, okay, guys? Hemophilia is a genetic bleeding disorder caused by a deficiency in which specific clotting factor? Factor 8. Question number 2. When a patient is experiencing a generalized tonic-clonic seizure, what is the nurse's primary physical intervention to ensure safety? Okay, so you want to clear the area of hazards, okay? You want to turn them on their side, and you never want to put anything in their mouth, okay? That can cause them to aspirate. Question number 3, true or false? For a patient with hemophilia, you expect their baseline platelet count to be decreased. False. Platelet counts are usually completely normal. It's a clotting factor issue, all right? Question number 4. A patient with severe syndrome of inappropriate antidiuretic hormone is at risk for confusion and seizures due to which critical electrolyte imbalance? If you said hyponatremia, which is low sodium, you got it right. All right, question number 5. How should a patient who's experiencing epistaxis or a nosebleed be positioned physically? So you want to tilt their head forward, not back, to prevent swallowing or aspirating blood. Question number 6. What is the specific standard reversal agent a nurse must have on hand for a patient receiving a continuous intravenous heparin infusion? Y'all ask for harder. Okay, protamine sulfate. Question number 7. True or false? When performing a physical assessment on an abdomen, the nurse should palpate the abdomen before listening to the bowel sounds. False. You always listen first, so palpation doesn't alter the bowel sounds. Okay. Question number 8. What dark purple or blue spots are commonly found on the lower back of dark-skinned newborns that are completely benign and should not be mistaken for abuse or bruising? Okay, the answer for this one is Mongolian spots. Question number 9. You're caring for a patient who just underwent a total hip arthroplasty, right? Upon assessment, you note the affected leg is shortened and externally rotated. What complication do you suspect? In a minute. Okay. Okay, so the answer is dislocation of the hip prosthesis. Okay, question number 10. A patient is admitted to your unit with a suspected active tuberculosis infection. What specific type of personal protective equipment must the nurse wear before entering the room? So the answer for this one is an N95 respirator mask. That's it for this video. Please leave your answers in the comments. Let me know how many you got right out of 10. Okay, and remember, I'm gonna always leave you with this. Never dim your light for anyone. Stay lit.